5-Minute Pearls for Clinical Practice. This is week 1, where we begin our discussion of how to have outstanding patient interviews. This week is step 1, preparation. Hello, this is Dr. Brian Morris, and this is 5-Minute Pearls for Clinical Practice, where you will learn the tools to provide exceptional care for your patients. This is the weekly podcast where you will be introduced to time-tested, evidence-based patient care strategies that aren't always taught in schools or training programs, but are nonetheless crucial for success in clinical practice. And each podcast episode is about 5 minutes. Over the next few episodes, I will be discussing the basic skills necessary to interview patients. We all know clinicians that have that special ability to connect with people, to instill confidence, to connect with patients. And of course, we also know clinicians that don't form that connection. They don't know how to connect with patients. They may be brilliant diagnosticians. They may be very nice people, but they simply can't make that connection with patients. So let's review the skills that are necessary to be in that first group of clinicians, to be able to connect with patients. Because these are learnable skills, they are skills that can be practiced and learned over time. The first skill and the topic of today's episode is preparation. We need to prepare for each patient encounter. Before we enter the room, before we take a single note, before we type anything into the electronic medical record, we need to make sure that we are prepared to see that patient. Preparation is so important, and it takes 2 general steps. The first is informational, and the second is our mindset. In the first step, we need to ensure that we have reviewed all of the necessary information related to that office visit. If there are tests or consult notes or outside medical records that we need to review, then we have them, and we have reviewed them before we enter the room. If at all possible, we do not want to review notes when we are with patients. Sometimes that is inevitable, but if at all possible, it is best to focus your full attention on the patient and not be reviewing notes. So we want to have reviewed all of the records, all of the notes before we enter the room. That way we know everything that's happened since the last visit and what needs to be discussed today. What was the plan during that last visit? Have you reviewed that? What were the med changes that happened with the last visit? Have you reviewed those? What were the tests that were ordered last time? And have you reviewed the results? If not, review all of this before you enter the room. Make sure that you are fully prepared and that you have reviewed all of the necessary information related to today's visit. In addition to having reviewed all of the information, the second part of preparation is your mindset. Make sure that you're in the right mindset for today's visit. Make sure you're focused. Make sure you are not distracted. Your attention and your concentration and your laser focus needs to be on that patient right now. Make sure that you are not thinking about your last patient or your dinner plans or anything else. Make sure that your focus is where it should be in the present moment on the patient and his or her needs. This was the topic of episode 1 of this podcast, and feel free to go back and listen to that episode for a refresher if necessary. So the first step in our little mini course here on patient history taking and patient interviewing is preparation. Be prepared, both with all the necessary information for today's visit and also make sure that you are prepared in the right mindset. The analogy I would use is how we recommend proper stretching before exercise. The stretching prepares the body for the exercise. Similarly, we have to be prepared for patient visits. Our preparation, our stretching, is our preparation, which is both informational and mental. Be sure to stretch before you see your patient. Be sure to prepare yourself. Review all of the information, and then take a breath, focus your attention, and then open the door to go see your patient. Let's keep the dialogue going. Let me know what you think of this week's Pearl for Clinical Practice. You can email me at drmorris@5minutemd.com. That's DRMORRIS at 5minutemd.com. You can post your comments and your experiences on the 5 Minute MD Facebook page. You can follow us on Twitter at Brian Morris MD, and you can visit us anytime on our website, 5minutemd.com. Let your friends and your colleagues know about the podcast and make sure that you are subscribed on iTunes. When you are subscribed on iTunes, you will receive new podcast pearls as soon as they are posted. And if you have a few minutes and you enjoy what we're doing here on this podcast, please head over to iTunes and leave us a review. Thank you so much for listening. I will see you at the next 5.